These are the patient's moles showing his habitual bite in centric occlusion. Notice the deep bite of the incisors, where the maxillary teeth completely obscure the lower incisors. Notice the maxillary right teeth in the buccal segment are lingually inclined when compared to the maxillary left teeth, whose buccal segment is more upright. These are indications of cranial distortions in the maxilla and will need to be taken into account in this patient's orthodontic treatment later on. This is a 15-year-old young man from Canada who we're going to start today. His tics began at 10 years old with his motor tics, and then his visual tics began vocal tics began, and we're going to have great success with him because we've put in our tongue blades and just brought everything to a screeching halt. And you did that last night, right? And how many tongue blades did you determine stopped it?
It seems that 5 is good for him.
5 is good for him. Okay, we'll have the appliance back tomorrow, I believe, and we'll put it in, and we'll start at that height or close to it, and just go from there. And we'll make you an upper appliance to take care of his cranial compensations. Right? We agreed on that yesterday, I believe. And I'm expecting very good results from this right away. This shouldn't be too difficult.
Okay.
And you remember our agreement, right? Our deal?
Oh, yeah.
Okay. Good. Okay, that's all for today. This young man presents at age 15 with multiple facial tics, including grimacing, as well as the obvious ones to the viewer, as well as vocal tics. The motor tics started at the age of 10, and the vocal tics started at the age of 11 and a half. His MRI was negative, but keep in mind the fact that there were motion artifacts on the MRI, and it wasn't as 100% conclusive as it would be on a non-Tourette's patient. But the main tip-off was that he had 100% deep bite, meaning his upper incisors completely overlapped his lower incisors when his teeth were in occlusion. 20 anatomical areas, usually meaning muscles, were sensitive to palpation with 4 ounces of pressure. Also, as you observe him going through these movement disorders, notice the hypertrophy of his right sternocleidomastoid muscle. Most of these patients will have cervical involvement as well as cranial and facial involvement, and the muscles will be hypertrophied in many cases, and cervical spine x-rays will begin to show initial degenerative change due to all the function that has been imposed upon the cervical spine. Okay, we're going to start treatment today. This young boy, it happens to be 20 minutes after 3. We're going to fit him with this lower mouthpiece for this movement disorder. You can see all these Tourette symptoms he's got going, and we're going to realign his mandible to his cranial base using this mouthpiece. This is a substructure for it, which the laboratory has fabricated for us overnight. We're mixing soft acrylic now, and we're going to put a new surface on it. We've determined that the vertical dimension we're going to start with is 5 tongue blades high, because we have given him tongue blades to experiment with last night, and he's been varying the tongue blades up and down in his motel room, and he's determined that 5 is a good starting point for him. Okay, give me this here.
It's perfect.
This goes on all day long. focusing on here now. I've just added a bolus of acrylic to the left side, to the right side, and I'm adding some to the left side. Just get some idea. Open. Wait. Is that about the height? That height feel familiar to you?
Yeah.
This wouldn't come off of that for a minute. I thought we were just going to have to send you home like that. Okay, old one. Lift up. When you're old like me, you don't like to bend over so much. Okay. Okay. Is that hurting you in any way? Digging into your gums in any way?
Nope, none.
Hurting your teeth in any way?
Nope, none.
Okay, cool. Mix. Give me those tongue blades.
No, they're done for it.
Right down. Right. That's enough. Just there. That's it. Okay, open. Just close lightly on it. Okay, good. Open now. Give me a scaler. Open, don't close. Okay. Rinse out. I just put in this boy's mouthpiece a moment ago. Wait. Yeah. Okay, and you can see the degree it opens his mouth. Bite. Now. And he's going to sit here with it for a few minutes while all of his nerves and muscles quiet down. And then I'm going to adjust it. And then we'll send him on his happy way. Now you eat with this, okay? You gotta eat with it, sleep with it, kiss your parents goodnight with it, all that good stuff. Do your homework with it, everything. 24/7 means 24/7. This patient returns after having had his lower appliance 17 and a half hours. He's been wearing it. His movement disorder has not been eliminated, it's just been reduced. He reports that he's had this best night's sleep ever last night, and we have great hopes for his continued improvement as the days go by. He'll be getting his upper appliance at his next visit, because it'll be constructed by the laboratory between now and the next visit that he comes. Do you want to say something for the viewing audience? Tell them how you feel.
Good. I feel good.
So they feel more relaxed?
Yeah.
The urges to that you've been experienced before, how are they?
They're less.
Less, okay. Can you put a figure on it? Like, are they 30% less, 50% less, 90% less?
Well, it's 60% less.
60% less, okay. Well, that's pretty good for 17 hours. This improvement will continue as time goes by. So, that's pretty good for a 15-year-old kid, right?
Yeah.
Okay. This patient came in after wearing a lower flat appliance for the past 25 days, which essentially resulted in no improvement. His tics continued the same, if not more, than when originally seen. Today we have put in an alpha appliance in his maxillary arch and cemented it in place, and converted his lower appliance from a flat appliance to a repositioning appliance to move his mandible forward. to take pressure off his temporomandibular joints. This has greatly decreased his tics, and if he perseveres in biting in the correct position that we have dictated for him, his tics should start to diminish very noticeably, very rapidly. Do you have anything to say to the viewing audience?
No.
Do you feel less urges with these changes we made today?
I just feel normal.
You feel normal? Huh?
Yeah.
Okay. Well, that's good. This young man returns the next day, 24 hours after receiving his upper appliance and getting his lower appliance repositioned. And according to his mother, he's had a 40% reduction in his tics in the last 24 hours. And he comes from very far away, and we're going to have a local dentist maintain the appliance in this position by refreshing the acrylic. And if that can be done adequately, then this boy's tics should diminish over time. It should be probably totally gone within 10 or 12 weeks. Okay? What's your idea of the improvement last night?
Well, from last night, there was slight improvements only, but this morning, with Giancarlo's, the way he said his sleep is much better, and we noticed that he has a more relaxed demeanor. He sat down and read the journal for half hour or so and picked a few points out of it and talked to us back and forth, which before he always seemed almost too tense to do any of those things. And this morning, the major tics major multiple ones were much released, much less. So he's having a few minors, but we definitely see an improvement.